Welcome to VA Voices, a periodic news and information series for those serving in uniform, retirees, and veterans across the state of Massachusetts. I'm Andre Bowser, your host. I'm also a Public Affairs Officer here at Westover Air Reserve Base and the Public Affairs Officer at VA Central Western Massachusetts Healthcare System. Our guest today is Mr. John P. Collins. He's the director of the VA Central Western Massachusetts Healthcare System, and he's also a 30-year Army veteran. Mr. Collins was in charge of hospitals in Germany, essentially occupying a one-star billet in his job. And can you tell us a little bit about your military experience as well as how you came over to the VA?
Sure, Andre, thank you for having me. I had a great career in the Army as a Medical Service Corps officer. Had a 3-year ROTC scholarship at Providence College, and thought I would do 4 years to pay off my scholarship, and 30 years later I retired as a colonel. As a Medical Service Corps officer, I went back and forth between the field, as we say, infantry divisions and combat support hospitals and the such, and as an administrator, healthcare executive in hospitals, so commanding hospitals and being the administrator for hospitals. At the height of my career was when I was first stationed over there in the 3rd Infantry Division in the early 80s. We had about 300,000 troops in Europe. We have about 30 today. So back then you had a massive network of hospitals throughout Europe. When I went later in my career as the Chief of Staff of Landstuhl Regional Medical Center, which is our major medical center that takes all the casualties from conflicts in Iraq and Afghanistan, that was really the only standing large medical center in Europe. We have a large health facility in Vicenza, Italy, and then we have clinics throughout Germany, Belgium, and Italy. So when I ended my career as the commander of Europe Regional Medical Command, we had Landstuhl Regional Medical Center as our major hospital, and then clinics throughout Germany, Belgium, and Italy. So I wasn't sure what I wanted to do when I retired, post-retirement. I thought about teaching, I thought about a lot of things. I wasn't sure I wanted to stay in healthcare. I wanted to do something a little different. I had a friend that got out of the Medical Service Corps and went to work for the VA as a medical center director. So in my search of what to do post-retirement, I talked to him, and the VA was getting a lot of attention at the time, a couple of years ago. And I said, I might as well continue what I've been doing, serving service members. And it was a very meaningful 30 years, serving soldiers and family members. So I look at this as kind of a continuum of what I did in the military, servicemen at a little bit different, and women at a little bit different point in their lives, but it's got the same meaning that I felt after 30 years in the Army.
And it seems almost seamless in that you could very well be taking care of some of those soldiers you took care of in Germany, if they are now veterans in the Pioneer Valley region.
Well, starting broader, the VA has 3 major organizations to it. You have the Veterans Health Administration, that's us medical centers, 150 in the country, and many CBOCs or community-based outpatient clinics, so that's healthcare. The second major organization is the Veterans Benefit Administration. They do all of your benefits, so your disability claims, educational benefits, housing, all that sort of thing. And then the third, the smallest, but a very high-performing organization, is the National Cemetery Administration. So they manage all of our national cemeteries throughout the country and do all of your mortuary affairs benefits. So those are the 3 big organizations in the VA. In terms of the VHA, in Massachusetts, we have 3 VA medical centers. Boston is a large level 1 medical center that has all of the specialties. Then you have Bedford, which is a smaller organization like ours, which is VA Central Western Massachusetts. In our system, we have the main campus here at Leeds. We have 3 clinics out here in the west, Springfield, which is a large clinic, and then we have 2 smaller clinics, Greenfield and Pittsfield. And then in central Massachusetts, we have a large clinic at Worcester and at Fitchburg. And in this last year, working together with UMass Medical School, together we've built what we call Plantation Street Annex, where we have audiology as a new service to veterans in Central Mass, so they don't have to drive to Boston or out here, and they love that. And we have podiatry and optometry there, as well as blind rehab and research. And then recently we opened up a new clinic right on the campus of UMass Medical School on the 7th floor of their ambulatory care center, where we have mental health, folks from our HUD-VASH, or our homeless program, and we were working with UMass Medical School to jointly share some specialties with them so that we can get veterans access to care that I may not have in my system and prevent them from, riding up and down the highways to Boston or Connecticut. So that's my vision there.
A lot of younger veterans are returning, and they may not even necessarily know that they have these resources available to them at the VA. What can we do to reach out to them? I understand that currently you're on a commission that's been started by the governor to do just that.
In my 2.5 years now in the VA, one of the things, as much as you think veterans would know about the benefits that are available to them, all of the studies have shown, and in my work in the last 2.5 years as I do town halls and talk to veterans, are that we still have to get the word out. And so there's several ways that we do that. I'm on the My VA Community Engagement Board meeting. We meet every couple of months. That's co-chaired by Steve Connor, who happens to be the VSO for the Northampton area. And so we get together and look at what are some issues for veterans throughout Massachusetts that we need to address. And I'm also, you mentioned this council I'm on the Governor's Council, the Massachusetts Service Member Post-Deployment Council. Okay. We'll start meeting soon and talk about how can we best help service members post-deployment integrate back into the Commonwealth of Massachusetts. So I look forward to that. Some of the best ways, the Massachusetts is one of the best states, if not the best state in the nation for veterans. The benefits are amazing. I've taken advantage of those myself. And they have a great website. The Massachusetts Veterans Services has a website, so just go to mass.gov and you'll find that. They've got an array of resources there that will tell you about both state and veterans, federal veterans benefits. Obviously, we have multiple platforms which you're helping me work on. We have Facebook, we have our website for VA Central Western Mass. And then the VA itself has done a huge improvement in terms of trying to consolidate all the different sites of information into one on the VA website. So I think there's a lot of different avenues to get information, but the biggest challenge we have, like any state, is how can we bring together all of us, nonprofits, the state, the federal, which is the VA, and organize ourselves to try to be a really strong integrated network. There are so many partners out there, private sector, state, federal, and that's what we're working on right now, is pulling all that together to reach out to all of the veterans in Massachusetts. I would just like to again say thank you to my fellow veterans for your service. Veterans are strong, resilient, productive members of society. There's some of us that need assistance. That's why we're here. And again, I'm proud to serve in the VA. We have a great staff. We've made tremendous improvements in our system in the last couple of years, in the VA overall, and it's just truly an honor and a privilege to serve. We're there for you. Get in touch with us. If there's anything I can do personally for any of you, I'd be happy to do that. And to the younger veterans and my peers that served like I did in Afghanistan or Iraq, it's not too early to learn about the VA, even though you may be young. Our average age is about 64, the veterans that we serve now, and many don't come to us until later in life. So understand your benefits now, whether it's health care or education. There's a lot out there for you. You're not always going to be in uniform. Someday you're going to hang that up, and better to learn what's out there and available for you now before you get out. So find out as much as you can now. There's a lot for you, and I want to thank you, Andre, for having me on.
Likewise, and thank you for watching VA Voices.